Bismillahirrahmanirrahim. The quote of the day is people who have no hold over their process of thinking era are likely to be ruined by liberty of thought. The topic of today's presentation is nutrition requirements under the supervision of Professor Dr. Saira Afzal. The learning outlines of today's presentation is introduction to the nutrition requirements, dietary reference intake, estimated average requirement, recommended dietary allowance, tolerable upper intake level, adequate intake, and the nutrition requirements in different stages of life. The learning objectives. At the end of this presentation, participants will be able to describe what are the nutrition requirements in infancy and childhood, adolescence, adults, pregnant and lactating women, and geriatrics. Dietary reference intake and its standards. Now, what is nutrition? Nutrition is the science of food and its relationship to health. Its aspects are food intake, absorption, assimilation, biosynthesis, catabolism, and excretion. Nutrition requirements. Nutrition requirement is the amount of various substances in food needed to sustain healthy life. Individual requirements of each nutrient are related to person's age, gender, level of physical activity, and state of health. These are different for each nutrient and also vary between individuals and life stages. For example, women of childbearing age need more iron than men. Each nutrient has a particular series of functions in the body. Good nutrition aims to achieve and maintain a desirable body composition and high potential for physical and mental work. Humans need a wide range of nutrients to lead a healthy and active life. The required nutrients for different physiological groups can only be derived from a well-balanced diet. Components of the diet must be chosen judiciously to provide all the nutrients to meet the human requirements in proper proportions for the different physiological activities. Now, what are the essential nutrients? Essential nutrients are the proteins, fats, and carbohydrates that are the macronutrients, and the micronutrients that are vitamins, minerals, and water. In this context, essentials means the nutrients that the body is unable to manufacture or produce in less quantities. Then they must be obtained from diet. Essential nutrients are necessary for energy, needed for the building and maintenance of tissues, relied upon for the regulation of body functions. Energy providing nutrients. There are three nutrients provide the body with energy that are proteins, fats, and carbohydrates. Energy measurements. Energy is measured in kilocalories. 1 kilocalorie equal to 1000 calories. 1 kilocalorie equals to the heat required to raise the temperature of 1 kilogram of water by 1 degree centigrade. The new unit of energy in nutrition mostly used is kilojoule. 1 kilocalorie equals to 4.2 kilojoules and 1 kilojoule equal to 0.239 kilocalories. Now the calorie density for different energy sources. Carbohydrate and proteins yield 4 calories per gram, while fats produce double the amount of energy as compared to carbohydrate and proteins that are approximately 9 calories per gram. Dietary reference intake. Dietary reference intake is the general term for a set of reference values used to plan and assess nutrient intakes of healthy people. Nutrition recommendation from National Academy of Medicine that is established in USA in 1997. Now, there are four standards of dietary reference intakes that are estimated average requirement, recommended dietary allowance, tolerable upper intake level, and adequate intake. Now, we will come toward the estimated average requirement that is denoted by capital E, A, and R. It is the average daily nutrient intake level estimated to meet the requirement of half of the healthy individuals in a particular life stage and group. Now, the recommended dietary allowance, it is denoted by the capital RDA. It is the average daily dietary nutrient intake level sufficient to meet the nutrient requirement of nearly all, approximately 97 to 98% of healthy individuals in a particular life stage and gender group. Recommended dietary allowance equals to the estimated average requirement plus 2 standard deviations. It is established by Food and Nutrition Board of National Academy of Science. It was first established during World War II in 1943. Recommended dietary allowance are the numerical values that provide nutrition guidance. Now the limitations in the recommended dietary allowances. It is aimed at preventing only nutrition deficiencies, but not in prevention of diseases. It is only for healthy individuals and not for the diseased ones and for those who are taking medications. It does not include all the nutrients. Now the tolerable upper intake level. Tolerable upper intake level is the highest daily intake of a nutrient that is likely to pose no risk of toxicity for almost all individuals. An intake above the tolerable upper intake level increases the potential risk of adverse effect. Now the adequate level. It is a recommended average daily intake level based on observations, experiments, or intake by a group of apparently healthy people that are assumed to be adequate. It is used when recommended dietary allowances cannot be determined. Now there is a flowchart diagram of dietary reference intakes. Here is the amount of nutrient. If the amount of nutrient is inadequately consumed, then the symptoms of deficiency may appear. And if it is consumed in higher quantities, then the toxicity symptoms will appear. If the adequate data is available for a particular nutrient and it is projected to 50% of population, then the estimated average requirements can be determined. And if it is projected to 97 to 98% of population, then the recommended dietary allowances can be determined. But if the data is inadequate, then only adequate intake level can be taken. Now here is a graphical presentation of the dietary reference intake. The risk of inadequacy, as previously discussed, is the estimated average requirement is 50%, while in recommended dietary allowance it decreases to about 2 to 3%. While the risk of toxicities or the risk of adverse effects in tolerable upper intake level is none. Now the balanced diet. A balanced diet is a diet that contains different kinds of foods in certain quantities and proportions so that the requirement for calories, proteins, minerals, vitamins, and alternative nutrients is adequate and a small provision is reserved for additional nutrients to endure the short length of leanness. A balanced diet should have 40% of the carbohydrates that are fresh fruits and vegetables, 25% should be proteins, and 25% should be the fiber diet, and 10% should be the fats. Now the concept of a my plate that was established by the United States Department of Agriculture in 2011. In this, the major portion of the meals will be of vegetables that are around 40%. The grains should be about 30% and proteins should be 20% and fruits should be 10%. And the dairy products should be approximately a glass of milk or a yogurt cup per day. Now we will discuss the nutrition requirements in infancy and childhood. Infancy and childhood is a phase of rapid growth and development of body. Food must meet the quantitative and qualitative standards of diet. Energy requirement per unit of body weight are greatest in infancy and declines later on. Likewise, proteins, vitamins, minerals, and water requirements are greatest in infancy proportionate to body size. Infant diet is composed largely of milk and may be deficient in ascorbic acid, vitamin A and D, and these essential nutrients must be supplemented. Now the nutrition requirements in adolescence. In adolescence, there is marked acceleration of growth prior to sexual maturity and puberty. This phase of growth occurs earlier in females than in males. The needs pertaining to calories and other requirements should be met properly. Now the nutrition requirements in adults. The key point at this stage in life is maintaining and sustainability rather than growth. Therefore, nutrient requirements vary mainly according to the gender. In gender, males use approximately 5 to 10% more calories than females because of their body proportion and size. In activity levels, different activities require different energy, but for some it requires more than the others, like during an exercise or physical workout. In health status, sometimes according to body condition, the body requirements are much higher than usual. For example, in increased body temperature, body burns more calories. Now the nutrition requirements, pregnancy and lactation. Dietary intakes, supplement use, and weight gain are among the most important characteristics of nutrition status that affect the course and outcome of pregnancy. Pregnancy complications are rare and infant conditions are better in those women who consume balanced diet. The pregnancy and lactation require planned diets to meet the additional requirements of essential nutrients, particularly the proteins, vitamins, and minerals. Recommended dietary nutrients during pregnancy. The energy, the amount of recommended dietary allowance of energy in pregnancy is it increased by 200 kilocalorie per day in third trimester only, and the proteins required in pregnancy are extra 6 gram per day above the recommended dietary allowance. The thiamine increase in line with energy and increases by 0.1 mg per day above the recommended dietary allowance. Riboflavin in pregnancy extra 0.3 milligrams per day are needed, while no niacin is required in above the recommended dietary allowance is needed in pregnancy, while the folate extra 100 microgram per day is needed above the recommended dietary allowance. The recommended dietary allowance of folate is 300 microgram. The pregnant lady should start the folate consuming 3 months before and after the conception. Vitamin C required is extra 120 milligram per day. Vitamin D 10 microgram per day. Calcium, there is no need of calcium increase. Iron extra 3 milligram per day, while the iodine extra 100 milligram microgram per day. On the old age, the dietary requirements during old age are less than those of adults as the basal metabolic requirements are reduced. The consideration of diet should be to maintain satisfactory, healthful years and should be of standard quality that contain adequate amount of protein, calcium, and vitamins. Accompanying the normal aging process are several physiological changes that value and important on the older adults' nutrition requirements. Now, the protein requirements in different stages of life in infancy and childhood from 3 to 6 months of age, 2.2 grams per kg per day is required, while in 6 to 12 months, the protein requirement is slightly reduced. In adolescence, it is required for the maintenance of present lean mass and rapid growth, while the requirement is 0.85 grams per kg per day. While in pregnancy and lactations, the protein requirement is 71 to 78 grams per day. While in adolescence, the protein requirement is 0.8 to 1.0 gram per kg per day, and it provides about 12 to 14% of total calories, a part of the total energy. Now the carbohydrate requirements in different stages of life in infancy and childhood. Milk. The main diet of infant is milk. It is the source of carbohydrates. It uses uh, uh, both carbohydrates and fats as source of energy and cannot fast, and infants cannot fast longer. Adolescents. Adolescents carbohydrate requirements are 130 gram per day. 45 to 65% of daily energy needs are met by the carbohydrates. Whole grains, fresh fruits, and vegetables should be encouraged during this stage of life. In pregnancy and lactation, carbohydrate requirement is 175 gram per day in addition to the usual intake. While in geriatrics, 50 to 100 gram per day are required. It constitutes of 50% of total calories. Fiber intake should be 20 to 35 grams per day. The fat requirements in infancy and childhood, and these are not exact recommended. The breast milk contains 55% of fats that are sufficient for fat intake by the infants, while in adolescents, it is equally essential like the protein and carbohydrates. Children above 2 years of age should not consume more than 20 to 30% of calories from fat. While in pregnancy and lactation, fat consumption is 33% among pregnant women. Percentage of calories obtained from fats should not change during pregnancy. In pregnancy, trans fatty acids should be avoided and it should be limited to the saturated fats, and the essential fatty acids should be consumed. While in old age, fat should not be more than 30% of total calories. Only 10% of calories should come from the saturated fat. Cholesterol should be limited to 300 gram or less per day. Now the calorie requirements. In infancy and childhood, 80 to 120 calories per kg are required in infancy. From birth to 6 months, every calorie need is 108 kilocalories per kg. While in adolescence, males, the calorie requirement is 2000 to 3000 kilocalories per day, while in females, it is 2000 to 2500 kilocalories per day. And it depends upon the activity level, basal metabolic rate, growth rate and it also depends upon the sexual maturity and puberty onset. While in pregnancy and lactation, an additional 300 calories per day are required. In second trimester, an additional 340 calories per day are required and in third trimester, an additional 452 calories are required per day. In old age, 10% reduction in calories need between age 51 to 75 years. An additional 10 to 15% reduction occurs after the age of 75 years depending upon the level of activity. Now the recent advances in the nutrition requirements. Here is the article which was published in Pakistan, that is the comparison of dietary iron intake with the recommended dietary allowance among the pregnant women belonging to the different socio-economic status. The study was conducted to compare the dietary iron intake with the recommended dietary allowance among pregnant women belonging to different socio-economic strata. The study was conducted in 3 hospitals of Lahore. The mean dietary intake was 12 mg per day, 20 mg per day, and 23 mg per day in lower, middle, and upper class, respectively. There was a significant difference in nutrient intake among different socioeconomic strata. The level of hemoglobin has variation from 8.9 mg per day to more than 11 mg per day among different socioeconomic strata. The study was concluded that the dietary iron consumption was lower than the recommended dietary allowance among participants of different socioeconomic strata. Here is the one more article, that is the effect of prenatal calcium supplementation on bone during pregnancy and 1 year postpartum period. Low calcium intake during pregnancy may cause maternal skeletal calcium mobilization to meet fetal needs. The recommended dietary allowance for calcium in non-pregnant, pregnant or lactating women in ages of 19 to 50 years is 1000 mg per day. Most women in United States report consuming 60 to 80% of calcium recommended dietary allowance, and insufficient calcium intake could increase maternal bone loss during pregnancy and reduce bone recovery and postpartum. This is the first study to our knowledge to assess the effect of calcium supplementation during pregnancy on measures of changes in cortical and trabecular bone from 16 weeks of pregnancy to 1 year postpartum period. At baseline, the woman consumed close to calcium dietary reference intake for pregnancy. Those receiving 1000 mg supplementation of calcium had a 4 to 5% greater recovery from cortical and total bone density at a weight-bearing site postpartum. The 1000 mg supplementation of calcium per day during pregnancy may improve bone recovery during the first 12 months of postpartum in women with calcium intakes averaging approximately 700 milligrams per day. Now the turn for the MCQs. The first MCQ is which of the following values is defined as the intake levels for nutrient estimated to meet the needs of half of the healthy individuals in a particular group. Whether it is dietary
Estimated average requirement.
Beta.
Yeah, beta is the correct answer, as the estimated average requirements are the intake levels for nutrient estimated to meet the needs of half of the healthy individuals in a population. The second MCQ is all females who could become pregnant are recommended to take 400 microgram of folic acid each day until pregnancy is confirmed. 400 microgram folic acid each day from the time pregnancy is confirmed. A C option is 400 microgram folic acid each day from at least 3 months before conception until week 12 weeks of pregnancy. Yeah, C is the correct option. Which of the following statements about recommended dietary allowance is true? Recommended dietary allowance equals to adequate intake. Recommended dietary allowance is defined as minimum dietary requirement. Recommended dietary allowance is statistically defined as 2 standard deviations above estimated average requirement, or the C is the right option, as the recommended dietary allowance is 2 standard deviations above the estimated average requirement. The highest daily intake of a nutrient that is likely to pose no risk of toxicity for almost all individuals, and if taken above it, increase the potential risk of adverse effect. This comes under the heading of inadequate intake, toxic intake, above average estimated requirement, or tolerable upper intake level.
Tolerable upper intake level.
Delta is the correct option. The last MCQ is which of the following is the limitation of recommended dietary allowance? Whether the recommended dietary allowance is for healthy as well as diseased persons, it gives nutrition requirements in person taking medications, or the recommended dietary allowance is for all the macro and micronutrients.
Delta.
It is aimed at preventing only nutrition deficiencies.
Delta.
Delta is the correct option. Here is the key of the MCQs. These are the references, and thank you very much.
Thank you, Dr. Awais, for the presentation. As we all know that nutritional requirements should be met, and they are the key to lead a healthy lifestyle. They vary with age, gender, level of physical activity, pregnancy, lactation, and nutritional requirements also vary in a disease process. When you have any surgery or any injury, the requirements change. And particularly in old age, nutritional requirements decrease slightly because they have less physical activity. But due to the problems of chewing and they also have decreased taste, or they have a high prevalence of nutritional deficiencies in old age. So there should be more programs targeting the geriatric age group, as the geriatric age group is expected to double by 2050 in Pakistan. If anyone has any question, you can ask. We can end this meeting. Thank you.
Okay, thank you very much.